Yeah. Happy Monday. What is the day? That's okay. Yeah. Welcome you all for our show called the Telephysio Show. And today, we are having an amazing chief guest called Dr. Amit Shrivas. Without Before introducing him, I'll give a small introduction about me. I'm Dr. Sandhya Ravi PT, physiotherapist who founded the Telephysio Solutions Private Limited. And in our Telephysio show, we have an esteemed guest who also use virtual physiotherapy to handle acute cases. Because a lot of our students and therapists asked us how acute cases can be handled in virtual sessions. So we have our guest will answer each and every questions what our students and physiotherapists had for this one. And I love to invite Dr. Amit Shrivas. Yeah.
Hi,
Hi, Dr.
hi,
Yeah.
hi,
Welcome
hi,
to our
Dr.
show.
Sandhya.
Thank you so
Thank you,
much.
thank you.
Yeah. Welcome to our show, Telephysio. So we are excited to have you to be our chief guest. And our students have a lot of questions about Telephysio. So having 20 plus years of experience being a clinical therapist, I think so you'll be the right person to answer those. Are you
Yeah,
excited?
yeah. Thank you so much, Sandhya, for inviting me here. And I'm also a host here. I would also like to ask a lot of questions because I know you are, heading this brand, and I am also inspired. And we are going to work together in future that we have decided. So let's see what we you have question for me today. So you can start with. Then I can also ask you.
Yeah, thank you
Yeah.
so much. My first question is I know you founded the brand called Physiocure. What inspired you to start Physiocure, and how has your journey been as a clinical therapist and also running it as a business, as a
So
founder?
what inspired me? Yeah. So Physiocure. Many people ask me that why you have made this name Cure because do physiotherapy cure? So many people have these conceptions that we don't see acute cases, we don't treat any disease completely, but this is total misconceptions. A lot of conditions, or especially the orthopedic conditions, actually exercise is the first cure, and it completely cures many cases. Like back pain, mechanical back pain is 100% cured by you know exercise therapy or physiotherapy. So that's why my focus was those cases where we actually treat the patient completely, and we are the first consultant and the last consultant for the patients. So that's why Physiocure is devoted for all those conditions where we actually give the full-fledged treatment as any physician or orthopedic too.
Yeah, that was really a great one. Yeah, mostly we also think it as a kind of generally when people talks about physiotherapy itself, they say it's a conservative treatment. So whenever
Yeah.
people say it's a conservative, something makes us feel like it's something like a old kind of treatment, like it's a very traditional way. It's not going
Or
to work.
secondary treatment.
Ah, yeah. So that gives us when these terms are which have been used in terms of physiotherapy is a conservative treatment and things. This itself will give some doubts and things in patients' mind. Yeah. So
Yeah.
that cure, I really loved it as your brand, Physiocure.
What
Yeah.
happens, I've seen that many experts, like doctors also won't know much about physiotherapy. They think that only post-operative or some rehabilitation we are needed sometime. But it's not true. We are needed from any healthcare system from day one to day last, because
Yes.
rehabilitation starts from the time when I would say in summary, like it's a preventive, curative and rehabilitative all.
Wow. True. I completely agree to that. And being a preventive physiotherapist, I know always I'll tell my patients before getting a problem, come to a physiotherapist. Don't come to
Yeah,
us after getting a problem. We are very good in helping not to get you problem. So why don't you
correct.
try that way? Yeah. So and how has your journey been as a clinical therapist and a founder of Physiocure?
So yeah, journey is not that small journey. It's not that simple journey. We have started from the time when there were no awareness about physiotherapies, And we used to think in our college days that we had done blunder taking physiotherapy. And we used to compare with other fraternities or other streams in medical health, like orthopedic or other doctors we used to compare. But now, gradually, the time has changed, the awareness has improved, and youngsters are doing well. There are a lot of innovation happening in our field. So more and more coming every day. So we are getting excited more and more, day by day, for new possibilities of physiotherapists. So it's quite exciting journey so far, and lots to do now. I think we have still begun, not even started our journey so far as physiotherapy potential is concerned.
Yeah. Can I know like how many years it's been being with Physiocure?
I think Physiocure I've started in 2015, but 2006 I passed out. I was working in hospitals, various hospital in Mumbai. Uh, so many hospitals I have experience working with in Mumbai, and then properly we started working in our own setup after 2015.
Yeah, I think so. Then, like as a clinical therapist, you're there for more than 19 plus years, and
Yeah,
Physiocure is more than 10 plus years. That's really big. And you are
yeah.
saying that your journey is just now starting. So it's great to hear.
I think physiotherapist journey has started. Like the potential physiotherapy, proper physiotherapy, people are now understand this word. At least they know this word exists. Earlier, when we were talking about physiotherapy, they had no clue. Now they know that this terminology exists, but they have to know more about it now.
Yeah, I completely agree to that. And how has telephysiotherapy changed the way you treat acute pain patients? That is my burning question. And
So
burning
first of
question of my
all,
students too.
yeah, yeah. First of all, I would like to thank you because you have started this brand of Telephysio, and you are a very young therapist. So far I compare with me. But Telephysio actually came across to my life, I would say, during Corona. So we had a lot of problems when we were seeing our patients. So we thought, why not online? We were doing online earlier also, but we were not, it was not that exciting because people don't have trust. People think that anything is done online is not that effective, not authentic also. And so far as therapy is concerned, it's touch based or machine based. And we also were thinking somewhat like that. And I also thinking perspective changed totally when I started seeing patients online regular basis during Corona. Not only orthopedic condition, because mostly my practice is focused on orthopedic condition, but that time during Corona we also were seeing the neurological cases, the paralysis cases. So one patient I had in Calcutta, so they were husband wife, 75-year-old, couple, both of them. And we could manage giving them service online, and they felt much better. And and they had come here after the Corona and recovering, you know after feeling much better after those sessions. They were so thankful and in gratitude. And then there I realized it's not only about orthopedic conditions, but neurological condition also can be seen online, which is little complex. So I realized, yeah, I think there's a big potential, and people should be educated about it, the telephysio, because it's not that easy. Why? Also because anybody who is seeing any patient online, they have to have in-depth knowledge and understanding about the science of the treatment, like the assessment system, the treatment system. Then only they can guide it. It's not only about the technologies. Definitely technology is an important part of the telephysio or telemedicine, but at the same time they have to have in-depth knowledge of the case which they have to treat. So it's go hand on hand. Yeah.
Sorry, I was unmute. I completely agree to that point, what you said. Like, technology is going to be a catalyst. If you don't have an in depth knowledge being a physiotherapist, technology is of no use. Always like what I feel it like 80% mindset and 20% skill set. what I feel in terms of the same way in terms of telephysio. It is like 80% physiotherapy and 20% technology. So
Yeah.
80% if you're a strong physiotherapist, then 20% with the technology, you're going to soar high in the sky. But if you don't have that depth knowledge in physiotherapy and technology, maybe it may backfire us too. Because for
Yeah.
me, like as you said, the same thing. Telephysio worked for me. Maybe I think so. That depth knowledge what I have in physiotherapy and in terms of an holistic healing, that was the reason like I can stand in this space. Yeah, but people thinks looking outside like she knows technology. That is the reason she's standing in the space. Actually, not. Technology helped me to go faster. That's it. Yeah,
Yeah,
but
I think your company, I would like to ask you this question. Like your company is technology based and I've seen it. So I would like to ask you the same question. Why you have started Telephysio brand? It's a very good
yeah.
brand.
Yeah, Telephysio brand. I don't know like whether I've shared this with you or not. I'm a tech phobic person in general till 2019.
Oh,
So I had phobia towards technology. Even I was not using a smartphone. Think how good I am. I don't
okay.
even use a smartphone at that time. So I had a complete aversion towards technology. I had a different mindset. Social media is of better ways. This technology is really creating more chaos than doing good. Yeah, so
Yeah.
it is affecting studies. There are so many negative sides of the technology. I was looking more towards the negative sides. So I could see like more cons than the pros. So I was not attracted towards technology. So I was always away from it. So I'm always a person love reading in the books, not through the Kindle app or things like that. I love going to shop and purchasing. I hate shopping in online. So this is how I am. So I'm completely a person like out of the tech and online things. Then later, due to this thing, like there was a particular point that I had a turning point where I got scammed online.
Okay.
Yeah. So that is when I realized it happened because I had an aversion towards technology, no? So that was one of the reason it gave the chance for the other person to scam me. So at that point, yeah, so it's a sad story, but now I literally laugh at that. And I'm grateful for that incident because that taught me more than my life or my education can taught me. So on that day, I decided I should learn technology. So then I started learning technology. Thank God COVID happened, which paved me the way towards
Thank
starting the
God.
Telephysio brand. So that is how I want to learn technology. I got into that space. As COVID happened, I what is it like? I mixed technology and physiotherapy together. Started researching more and more. That is how actually the telephysio was not the option. So initially, I want to create this name as telephysio was not the name for the company actually. The name was completely different. The name was
Okay.
ePhysiocare. You have Physiocure, right? So I picked the name called ePhysiocare.
Okay.
E means doing online, Physiocare. So I want to provide more care, holistic care towards the patient. So that was the brand name I created. But already there was a brand name called Physiocare.
Okay.
So when just adding E, I didn't get that name when I applied for it.
Okay.
Then I said to my team, because I thought Telephysio is a very common name, no? Someone would have taken as a business name. That was there in my head.
Hmm.
Then I said to my team for applying the name as a private limited company. So I said like, why don't you try for Telephysio Solutions Private Limited? And as soon we picked, we got the name. So we were super happy about that. Then I'm very happy when I couldn't get ePhysio care. Initially, I felt a little bad. Oh God, I couldn't get that name. Then later, I'm happy. I thanked the universe because the universe wanted me to go with a brand called Telephysio, which is much more popular than the
Yeah.
ePhysio care brand. Yeah,
That's great.
blessing in disguise. You can say like that.
Cool. Cool.
Yeah. So that's how everything happened.
Hmm.
And I have a question. So most of my students ask this one. Yeah, ma'am, in online, like no modalities, no hands-on therapy. When patient says like I have severe pain, how can we handle this? Because in
Severe pain.
offline, yeah, when we have pain, how to handle pain in online? So that's a
Okay.
very common question I get it from my physiotherapist too.
Yeah, absolutely. You know what I've seen, like a lot of physiotherapists are not aware that pain management can be better be done by exercise interventions,
Yeah,
posture corrections. So why we are getting pain? So if we talk about pain management, what kind of pain we manage? If we understand all of us, then we'll definitely understand how we can manage the pain. So we are managing what kind of pain? Like mechanical pain we are managing, right?
yeah,
And what is mechanical pain? Anything or any pain which is intermittent and changing by the change of the posture, the movements, or any physical strain in the body, the deformation, the postural problems, or derangement, right? So if we correct it, the deformation, the postural issue, and the derangement, and some derangements are acute, some are chronic. So acute derangement can easily be managed in just few minutes. Also, the severe I have seen in my career, like in few minutes, severe chronic pain also. It's not chronic pain. So what happened? Acute pain in chronic condition happens.
yeah,
So maybe acute pain in chronic conditions. So they have acute pain, which they have, because of derangement or postural problem, which can be corrected in few minutes. And later on, we work on their chronicity or their muscle strengthening and long-term recovery is later part. So by simple posture corrections, simple movements, by understanding, the main thing is the diagnosis, the correct assessment, and understanding the cause of the pain. And then we have all the techniques, like even apart from posture correction, we have soft tissue release, joint mobilization, like Meatland techniques. So by simple touching and proper positioning of the joint, positioning of joint do wonders. Like if they're getting pain, they don't know how to sit properly,
yeah,
how to sleep properly, so that they are walking back, in an awkward posture. So all this we correct immediately, they get pain relief. So whenever we have this workshop for IT professionals, whenever we correct their posture, immediately they feel better. So 40 to 50% of pain is reduced there, you know, immediately, and
yeah,
it's very easy to understand. But the perception, this perception in mass public, we have that pain need medicine, painkillers. That's why they have this perception. Otherwise, there are far better way of pain management rather than medicines.
yeah.
Yeah.
Thank you so much for answering that. And right now, as you said, like sometimes few hands-on techniques, but as it comes to virtual, where we can't do the hands-on
Yeah.
techniques.
Yeah.
So, what is the answer they you have? So that's what my students are looking for, and even I'm looking for.
Yeah, that is a challenge
I,
with telephysio. I
yeah,
understand that some hands-on techniques we cannot apply on our patients. We also some modalities we are not able to apply on our patients. So what happens, if patient is sincere and the therapist is sincere to give service, patient is, looking for and committed for the service, then we get some solution, and we send them videos. We take help our relatives to do some kind of hands-on if it's really very much required, or we give some tools also. They can buy some tools, and their relatives, patients relatives, can help them. Somehow we have to, it's still innovation is required in this area. The lots coming up. So
yeah,
I think there's a company in India who have uh, developed machines which can be operated from distance. So there are a
wow,
lot of people are innovating in this area, how we can you know uh, reach out to people so far as our best treatment is concerned, from distance. So
yeah.
yeah, there's a challenge, but yeah, there's a lot of scope of innovation in this area.
Yeah, thank you so much for that was really an amazing thing. Yeah, as I know, like going forward, if we are not going to upgrade in terms of technology, uh, we are gonna suffer. Like I love
Yeah,
this quote, or like I can say, like I love this proverb. Like if you're not updated, you'll be outdated.
correct.
So
Absolutely.
Yeah.
Yeah.
So I want to know, like, what are the biggest challenges in virtual physiotherapy you are faced, and how do you overcome them?
So just first challenge we already spoke about, that is there are some specific techniques, very good techniques manual we cannot apply on a patient, and
Yeah.
also the modality we cannot give to a patient virtually. This is the biggest challenge. uh, but we have to do how to address this challenge by researching more on exercise therapy.
Yeah.
So we can focus more on exercise therapy, long term management, and there are a lot of instructions. So what advantage we have of exercise therapy? If you are giving exercise therapy as a treatment option, then a patient learn a lot of things. Long term management, they learn how to manage at home in their home environment is very very beneficial, sometimes more beneficial than giving them modalities. So
Yeah.
this is the first challenge, and all the challenge we have the solutions, not an issue. Because
Yeah.
we are trying this on day in and out. I have 4 or 5 patients every day online. We are seeing all over the globe, not only in
Wow.
India. We have NRIs and foreigner also we are seeing. So we are, you know, uh, going through challenges and coming out of uh, challenges with some solutions. And second challenge is trust. People don't trust us, especially people who especially people who don't know about telephysio, and and they don't know about physiotherapy in general.
Yeah.
They wonder how virtually it can be done. So the trust is the biggest challenge. So how we can handle the trust factor is by creating awareness. So we that's why this podcast with you will play a role here, and I will request all the people who are watching us should spread this podcast to many, so that they understand. I mean, this is future. The virtual treatment is a future because we don't have enough time, and it also save our resources, time and money. And I would say sometime equally effective, and sometime more effective than clinical treatment, or physical treatment, physical therapy. Yeah.
Yeah. As you said, like when you said it's going to save the resources, I got a point to share. Like, yeah, I'm very much concerned about the environment. I see, like, because of the transportation and things, like how much pollution is happening, like going
Yeah.
and forth towards the clinic, going to the hospital, and things like that. Because of this remote healthcare, as telemedicine or telehealthcare or telerehab or telephysio, whatever is coming in terms of technology part, I think so that is going to help patients to save the globe also in terms of global warming, like reducing pollution. And there are so many benefits for the environment. Also, I could literally see uh, because anyhow it's getting more digitalized, digital literacy also getting like more and more every day, passing each day. So this is going to help a lot of people. And very very important is like even people who are in very rural areas can get expert advice by staying from their home, because every household will have maybe the elderly people cannot have a smartphone, but for sure at least one person in the family will be having a smartphone where they can get access for an expert consultation from the place where they are for their family members. So that is one of the great advantage I can see through virtual physiotherapy.
Yeah.
Yeah. Uh,
Correct.
yeah, I have one more question for you. What advice would you give to physiotherapists looking to integrate telephysio into their practice?
Yeah, I mean, that's what we have come together to give a lot of advice to people. Uh, you know, I mean, we should be innovative, and we should understand the concept, the treatment concept of physiotherapy, what we are trying to do. So, exercise is a part of our curriculum, and we are exercise experts. So, we know that exercise can be given virtually. So we should understand this. Whatever advantage we can give, like home program, you can send videos to your patients. You can record some session and help them. Patient education. So even if you're 100% physical clinic, even then you can take advantage of the technology, and slowly and gradually, you know go towards the telephysio side. You can also consult patients. If you're not fully consulting, maybe you can just give patient educations. You can talk to your patient virtually for the follow-up.
Yeah.
So, home program can be given through videos. I said follow-up consultations, and so that's what it will be easy even if you are seeing patient from distant, and they're coming to your clinic once or twice is enough, and then later on you can be in connection with them. So that's what I would advise all the therapists to do, so that we are also, you know, come to that mainstream. I've seen a lot of university in many countries are working on digital health. They have developed a course, and many courses are going on, and the whole health system is changing. You know, and that's why they are trying to incorporate the digital system in the existing healthcare system. So, as physiotherapists, we should all have responsibilities to take care of therapy part going digitally, right? That's what I
Yeah.
have to say.
From the conversation we had right now about like how virtual physiotherapy is going to change things, and I have one question. This is not in terms of the students of physiotherapists. This is from the public point of view. So generally, like right now, you see, like even I also have got patients at times. Like, yeah, last time I had a pain in my ankle, I saw a YouTube video and I did few exercise. It got all right. So right now, the same problem came for some other thing. I tried the same thing, it didn't work out. So because sometimes, at present there are like Google doctors, Google therapists, YouTube doctors, and YouTube therapists are there. So we just generally, like, public no, so it's just exercise. So
Yeah.
what's big deal in it? So because people are thinking exercise is not something, they don't understand exercise as a medicines. They think
Mhm.
exercise is not a big deal. Why should we pay for exercise? That can be done on our own. It's not a big deal. It's just lifting our hands up, lifting like this. What is big difference is going to happen? So what is answer for those? What answers do you have?
That's what this is due to the lack of awareness.
Yeah,
Physiotherapy is nothing but exercise. Okay, those
yeah,
modalities have role, but okay, that is that have role in pain management. But basic therapy is exercise therapy.
yeah,
So physios are movement scientists, and movement is actually people don't realize that movement is not very general. 80% back pain are mechanical back pain.
yeah,
80% back pain or mechanical. And the biggest disability healthcare problem is back pain throughout the world. And 80% of back pain is mechanical. And this mechanical back pain is 100% treated by movements, corrective movements, corrective exercises.
yeah,
So if it's that important, how can exercise be so general? So exercise is too specific. Like for example, how I give example to my patient to let them understand. Like we have duty in ICU, correct? ICUs.
yeah,
So
yeah,
why we have duty in ICU? Ask anyone. So
yeah,
everybody know. I think we have physiotherapy department in all the hospitals, and
yeah,
physios go to ICUs, wards, and also playgrounds if of sports physiotherapy, from ICU to playgrounds, like various fields we work on. So in
mm,
ICU, one movement can save life, correct?
mm.
like
Yes, I completely
like
agree to that.
ankle toe movement can be fatal if it's given to wrong patient at
Yeah,
the wrong time. At the same time,
correct.
it can save life if it's given to right time to right patient. Same way, chest
Yeah,
conditions. Chest
yeah,
physiotherapy is nothing but movement, postural drainage. The
yeah,
percussion, the shaking, the vibration is nothing but it's exercise, form of exercise. And we save life. Again, you must have seen during Corona how proning was saving lives of people. You
yeah,
know, lying on your tummy, proning and breathing. That was actually creating more oxygenation for people and who were dying. So it was actually saving lives. So such simple exercise was saving life during Corona time. Everybody know proning. If you see, go to back side during Corona time and search for proning, you'll understand what I'm talking about.
yeah,
All TV channels, everybody was talking about proning, do proning, and this is physiotherapy technique.
yeah,
So that's what I give example to my patient. how exercise can be so specific. If it's so specific in ICU, why not for you in any disease condition? So any disease condition, we give specific movement as treatment. We call it exercise therapy. This
Yeah,
is not exercise in general, but this is exercise therapy. So we have to create a lot of awareness. Nothing will happen otherwise. People
yeah,
will
yeah,
have we have to know and experience the magic of physiotherapy. Then only they'll believe in this. Yeah,
yeah. No, I completely understand that. Right now, as you said, the same thing at times I say to the patient. Right now, as you mentioned a few things, like there is one movement can cure, but there is the same movement which can kill the person also.
yeah, of course.
Because yeah, suddenly, like I remember my times in ICUs during my internships and during
Yeah,
my college days. Yeah, because sometimes if without knowing the patient is having a DVT, okay, for a
yeah,
DVT, if you give an ankle to
yeah.
movement, the person will die. Yeah,
Absolutely.
but at the same time, that movement given earlier phase, it can prevent DVT in the first
Yeah,
place. So that is very, very important. So as you said, right time, right exercise at the right place. That is very, 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 very important. So always I tell to patients also, it's not about exercise. It's about which exercise is right for you at the right time. That is very, very important because people think exercise doesn't have a side effects, but I strongly tell to patients like exercise have more side effects than any other medicine.
yeah, yeah. One more
Because
analog I have about it, like
yeah,
how a chemist shop have lot of medicine out there in the
yeah,
shop, all
yeah.
kind of medicine. So can we just buy randomly any medicine and consume?
No.
Same is the exercise. So exercise library we have or exercise shop. We will decide what kind of exercise to be done to the patient and what timing, frequency, duration, everything is done by us. So that is expert is
Yeah,
needed for that. It's not that easy. Any
yeah.
exercise will not help you. That's why.
Yeah, thank you so much for showing a light on it because that literally opened for me also. Yeah, sometimes people, I also like, we go for camps and things because I also run a clinic in Uti. So that's a completely a tech based clinic what we have in our hometown. So sometimes we go for camps and things like that. So when they say there is a physiotherapy camp is also happening, so sometimes the elderly patients who comes, they say like, yeah, every day I sit, stand, walk. I do physiotherapy every day. So then I feel okay. Yeah, thank you so much. I'm happy that you're doing movements at the age of 75, 80. I'm very, very happy with that. But physiotherapy is more than what you're doing in your day to day activities as well. Yes, because people think that I move every day. Why do I need physiotherapy? Physiotherapy is for people who are sitting throughout the day because I get this
Yeah,
things people. Yeah. So each one's perspective about physiotherapy is completely different.
di-
As,
different.
as you
Many
said,
people ask you, what is the difference between yoga and physiotherapy? Then wonder why they have asked me this. Yeah, you know, so I
yeah,
mean, an expert asked me, experts, doctors
yeah,
ask me. I mean, that is so amazing. But it's okay because physiotherapy is still in its childhood phase. People aren't aware. Physiotherapy is very good, but people are not aware.
yeah. Not only that, today morning we had a case. There was a case of done a surgery to release carpal tunnel syndrome, something. They've gone through the surgery and
Proper.
they came to the clinic and they said right side there was a procedure gone and the left side shoulder the person is having pain and my therapist came and said, ma'am, doctor have diagnosed it's a frozen shoulder and they need to take physiotherapy for the same. Then actually I said, first do the assessment whether the patient is having frozen shoulder or not. Sometimes it has been misdiagnosed as frozen shoulder.
Yeah,
Then later my therapist came and said, no ma'am, there is a little bit of tendonitis, that's it. The patient is doing actively the full range of motion. There is nothing to do with, even in passive, the pain is complete. There is no pain in passive range of motion. And I said, sometimes I was thinking like, from where did this frozen shoulder came as the diagnosis for this particular person? Yeah, sometimes it happens.
yeah.
Yeah, and most of the time, what do you think about people going through this very fancy investigation procedures? What is your
Yeah,
stance
yeah.
on it?
Yeah, you
Yeah,
know what? There's two things in this area. One thing is the physiotherapy assessment,
Yeah.
and that goes little differently than medical assessment.
Yes.
Medical assessment, I mean to say, the physician do their diagnosis or assessment or examination, and what we do is totally different. Why I'm
Yeah.
saying this? Because we are actually assessing or examining the physical part of the human body, like the range of motions, the physical condition of the joint,
Yeah.
muscle strength, the posture, you
Yeah.
know, the alignment thing, and their ability to do functional activities in day-to-day
Yeah.
life, and also the potential
Yeah.
in the future, how much they can be rehabilitated to.
Yeah.
Because if you are assessing any sports person, we have to have the vision and how much we can work on this patient. So we have to
Yes.
assess our own assessment is, we have to make. So it's like joint conditions, muscle conditions, posture, alignments, body alignments, and the functional assessments we have to do. This is different than normal, medical assessment. Because
Yes.
medical assessment goal is to give medicine and surgery. Our goal is to give exercise therapy, functional recovery, and the long-term fitness improvisation for their optimal health. So that's
Yeah.
what our assessment is depending on whatever we are focusing on,
Mm.
and medical doctors assessment depending on what they have interventions like medicine and surgeons is totally different. So that's
Yeah.
why we don't rely much on investigation reports. We also have to do some red flag rule out things like
Yeah.
cancers or any complications are there, then we have to know. Rest we do our own assessments and movement
Yeah.
assessments, and then we give intervention accordingly, the movement therapy, or in pain management also we do therapies.
Yeah.
So
Because
that's
why
why,
did I? Yeah. Yeah. You can complete it. Then I'll
yeah,
be
what
asking.
happens, people are confused. Sometimes they tell us, I have got this prescription by doctor after
Mm.
proper examination and proper conclusion that I have to do this therapy.
Yeah.
And then we say them, no, we have to do our own assessment, and then we'll decide what kind of therapy is needed for you. So then they
Yeah.
get confused. So
Mm.
then we have to explain them our assessment is a little different, not the same assessment. We are not gonna copy paste them. We have
Yeah.
our own assessment. So that's why it's very important for them to understand, especially the patient I'm talking about. It should understand.
Yeah.
So this is what I have to say.
Yeah, and as you were telling that, because why did I ask this question is because I've seen a patient, like I can say, like 3 4 years back. Yeah, so
Yeah.
this was a very typical condition, like where the patient already gone through a surgery. Okay, for the
Hmm.
L4 L5 issue. I think so.
Okay.
Laparoscopy or something is done because of the nerve pinch and things like that. But later, after 15 days, the patient came with the same symptom what the patient had, like 15 days back, for which what have the surgery have been made. Maybe like I think so. Like I don't remember. It's like a 15 days old or like 1 month old post surgery patient. Then later, like we came to know that the patient was not suffering. The nerve impingement was not due to the L4 L5. It was to do with the piriformis, and we did the
Yeah.
release there. And patient got all right. But here is the patient have already gone through the surgery. Now nothing can be done regarding the surgery because
Yeah.
the symptoms what was faced by the patient is something related to the muscle, nothing to do with the vertebrae or like with your back. There was something different. So sometimes because of this misdiagnosis, completely relying on the report and the decisions taken in terms of the surgical, it's completely affecting the patient life. So
Yeah, of course.
so
Yeah.
at times I feel it like whenever my patient comes also, I'll say like, okay, we'll see the report. Later, like we can correlate whether it's right or not. But first I need to ask few questions before I'm looking at the report. Because as soon we look at the report, we will have a mindset that this is the problem and we will come to the conclusion this is how our treatment should go. So generally I'll advise my therapist or whatever, no, not seeing the reports at the first time. First go with your assessment, then cross check with the report, like whether your assessment and it's same or it's completely different. So we will understand what kind of intervention we have to provide for the best results or best outcome for the patient. Yeah, so
Yeah,
eh,
absolutely.
yeah. So, have you came across the conditions like that also in your practice or things like that?
Yeah, like what?
No, right now I said no. The problem was completely different, but the medical intervention, what
Yeah,
the
that
patient.
way. No? Every day, on everyday basis, we get this. See, that again comes to awareness. See,
Yeah,
if somebody is calling us doctor,
yeah,
if they are calling us or not, that is different thing. If we are spending 4 5 years in our graduation,
yeah,
how can we just blindly follow any treatment? Impossible.
yeah, yeah,
How can we blindly follow any prescription or instruction by any doctor? No, not at all. So we are independent practitioner all over the globe, uh, and we have our own examination, proper full examination, and we get every day this lack of awareness from the patient that they insist us to just directly and treat them. A lot of surgery, as you said, that a lot of surgery is done without proper examination.
mm,
70%. I had seen one report, some time back, that 70% spine surgery can be avoided.
yes,
Yeah. So this is happening due to this only, because people don't understand what we diagnose, what we assess. But definitely, one physiotherapy has to be very much aware, knowledgeable about it. You know, then only they can properly. I would request all physiotherapists to upgrade their knowledge. I mean, it should be top notch, in technology, in assessing patients. And technology, I'm talking about the science behind the assessing the patients, the
yeah,
biomechanics part, the physics part, posture part, the alignment thing. That is the main thing what we are seeing in patient in any health condition, whether it's women
yeah,
health, orthopedic, neurology, or pediatric, geriatric, community based rehabilitation, or sports medicine. These are the
mm,
streams of physiotherapy, post graduation streams. People are not aware,
yes,
so I have very good video on this, what is physiotherapy, in YouTube channel. People can go and watch that.
sure,
So in all areas, if you see, what we are trying to do, one thing only, we are
yeah,
assessing patient physical inability or mechanical issues. Whether
mm,
it's neurology, also we are doing the same thing. The
yeah,
imbalance in the
exactly,
muscle, the stiffness in the joint, the weakness in the muscles,
yeah,
the alignment issue, the same thing we are finding. So body has biomechanics, the physics
yeah,
part, which we take care of.
yeah,
In orthopedic, the orthopedic only people know, orthopedic only physiotherapists are there. We treat
yeah,
some cases of orthopedic if only orthopedic will say us to do that. Otherwise no. But it's a total misconception. We in recent times, you also have seen that how we are focusing on women health. So there
yeah,
also have seen a lot of lack of awareness insofar as women health is concerned. So it's all about exercise, how exercise play important role in any health conditions, whether it's women health or child health or geriatric health. It's important, and
yes,
exercise is very important even in lifestyle diseases, whether it's
yes,
diabetes, heart conditions, neuro condition, and all this preventive medicine are talking about two things only:
yeah,
exercise and nutrition.
nutrition, food,
Yeah, so exercise is major part of our health system, our preventive medicine system, or long term maintenance of better health system. So
yeah.
I think it's broader spectrum we deal with. We are more important than anybody who is just giving medicine and surgeries. What do you
No,
think so?
I do. No, I completely agree because, like, I can say, like, I love being a physiotherapist, and I'm proudly allowed to say, like, recently also I was giving an interview where, like, people asked, like, how in India can we use, because in few countries, like, doctor tech can be used or not. Then I said, yeah, we can, but always we use with the suffix pt because we want to create a differentiation because sometimes nowadays like even personal trainers are using the name called pt, so we need a differentiation and also like we are eligible to use this one in terms of having a suffix as a pt.
Yeah.
So always this arguments and things are going, and I'm very happy like I have doctors around me like who are physicians, who are surgeons, calls me doctors, so I'm happy with that. So the people who are
Yeah.
coming at present, they understand and they also agree and they also acknowledge what things we are doing, because when we do things right, then automatically we get the recognition. Sometimes I feel it like, are we doing right in the every part? So sometimes I feel it like we should question, because it's not they don't recognize at all. First, what kind of recognition we give to us is also sometimes I feel it like a question to me.
Yeah, that is main important things. Yeah,
Yeah.
you have to understand our subject better. You know,
Yes.
I mean, nobody can take our recognition and our respect. This is in our hand, because I mean, nobody can replace us. Why? The in-depth knowledge of any health conditions, we also have, and that
Yeah.
comes not in short time. It takes a lot of, many years of hard work and knowledge of exercise, and at the same time the health condition. This is
Yeah.
the junction. Physiotherapy is integrating the two.
Yeah.
If you talk about personal trainer, they are doing their job. We appreciate
Yeah.
them, but they
Yeah.
are not studying much about the clinical conditions. They don't
Yeah.
have time for that. So
Yeah.
we cannot be compared with them. Although they use exercise for fitness, that's fine. But lots to do in health aspect.
Yeah.
So cannot be replaced by anything.
Yeah.
Physiotherapist, if somebody not respecting us, somebody not recognizing us, their problem. Yeah,
Yeah.
of
I
course, their
completely
problem.
agree. Yes.
And a patient who is not not being aware, then their problem, who will
Yeah.
suffer ultimately.
Yeah.
I have a lot of patients who don't understand. Even if we say that no, we will examine you and then we'll decide your treatment, please. And these many sessions are required, then they don't understand, they don't believe us, and then
Yeah.
later they suffer, and they
Yeah.
maybe come
But
back
later they
after
come.
some.
Yes.
So
I know that.
that's what happens. So no
Yeah.
problem.
Yeah. So that's completely. And as we are going to wrap up, I have like one last question to ask. Like, I literally love the conversation how it's going. Like going from physiotherapist
Yeah.
point of view to getting into the public awareness, like what people
I
have to
think
know
this is
about.
our first podcast.
Yes. We are going to do more. Yeah, but
Yeah.
today, as we are concerned more about the telephysio part. So, where do you see the future of telephysio is heading in the next 5 years?
That's what I say, that I have heard that a lot of universities in many part of the world, that they're working on digital healthcare system. They are
Yeah, why not?
developing new systems. So this
Yeah,
is our opportunity also. This big
yeah.
opportunity. Like as physiotherapist, I have opportunity to get connected to all the people out there in different part of the world and treat them. And why not? We are anyway doing. So this is the opportunity. It's like opportunity is big. And earlier in physical system, we didn't have much opportunity, where we had lack of time. We were not able to reach out to remote areas like villages.
Yeah,
I have a lot of patients these days. I'm treating my relatives who are in remote areas, like in villages, and
wow.
they're so happy. So this is the scope of future. 5 year down the line, I think if everything going great, then we will multiply our growth at
Yeah,
least 10 times.
yeah.
Why not?
Ash- Actually, the statistics say the telehealth market is around like, I think so, $582.79 billion industry in by
Yeah,
2027. In next 2 years, this is the market size in terms of
yeah.
the dollar aspect.
Business.
Yeah, it's a
So
business
business
aspect.
is good.
Yeah. No, there is really a literally a big need in terms of like work from
Need
home.
also.
And not only that, because physiotherapy, very, very simple. We talk a lot about mind, but controlling your mind is very, very difficult. But your mind and body is interconnected. So whatever trouble your mind facing, if you need to release it, you can do with your body. That is
Yeah,
such an amazing tool what we have. Being a physiotherapist, we can do that just like that, because sometimes
that's
you can't control your mind, but you have complete control of your body. So each and every emotions can be released through your body movements. It can be released through your body. That's something super amazing, like where we know how to do it. I think so we need a little more in-depth knowledge in handling this, where we can do super amazing space in terms of mind and body. So that is what
yeah.
I'm seeing the future towards the telephysio as well.
Yeah. What you're talking about is mental health. Definitely, there's
Yeah,
a big role of exercise therapy in mental health,
yeah,
and everybody know that. So, who is the expert? People are not aware that we are expert. We prescribe exercise for specific mental health conditions. I am telling you this from here.
Yeah.
Being in art of living, I'm also a spiritual teacher. We teach meditation and pranayama, yoga, apart from physiotherapy. And I've seen the tremendous results of other form of physical exercises, like posture is nothing but exercise.
Yes.
Breathing exercise in exercise. Mudra pranayama. Meditation is a form of physical technique where you have to
Yes.
sitting and mental techniques, physical mental techniques, breathing, focusing your mind to the breathing techniques. These all are, you know, can come, in physiotherapy, therapeutic approach, and we use
Yeah.
all these tools to, help a patient in mental health.
Yeah.
So this is the
Meditation.
scope.
Yeah, as you said,
Yeah,
meditation is nothing but conscious breathing. So when you're consciously aware
conscious
about your
breathing.
breathing, it's called
All
meditation. The
physical. I mean to say it's a physical.
yeah, it's completely physical. I completely agree to that statement. And as you said, posture, like yesterday, also like we were sitting and discussing. So like there was an interesting conversation going between me and one of my friends. There we were talking about like the posture of Adi Yogi. So how amazing the posture. That is one of the best posture, like where your mind opens up, your body gets into alignment. So then we were talking about, yeah, that's true. But always you see like Adi Yogi's posture will be like sitting in this, the head a little bit tilted. That's one of the best posture. Like we used to sit in schools and listen to like that, correct? So if you
Yeah,
believe
yeah.
like, sitting in the first desk and we'll be looking at the teacher like this, so where we can observe more, like we can learn more, and that posture is going to help us with an alignment where we can understand things better.
Of course,
So
of course.
yeah.
Anybody who is depressed, you can understand. I always say this to my patients. Anybody who
Yeah.
is depressed, how do they sit?
Yeah.
They will be like
Yeah. Oh
sitting in round
god,
shoulder.
no, I can say
So
this is
it's
the
like,
posture.
so you
Yeah.
know what happens. So it's our mind is related to a posture. The way you
Yeah.
sit also will feel better, right? Your chest will expand when you are
Yeah.
feeling good, and if you're not
Yeah.
feeling good, you will feel like this. So the same way, by correcting posture, we correct the state of our mind.
Yes.
Amazing. So
No,
we do amazing things. Yeah,
yeah, as we do amazing things, only thing is like we should do more awareness programs to reach people so that they know that uh, there is one particular profession, that is physiotherapy, will not only cure you, will help you to prevent not to get into the problem in the first place.
yeah, yeah.
Not only physically, just correcting your physical, that will going to stay change the state of mind, gives you clarity, helps you being more productive in your work, more productive in your life, which will also improve your relationship better, will help you to understand things better, because will help you to get aligned. And sometimes I can say even sometimes you can get your enlightenment with physiotherapy. I think so.
Oh, yeah. I mean,
Yeah, so I
you're
got
very
into space
optimistic.
of the physiotherapy and get enlightened. I'm going to change my brand name, I think so. To get
Yeah,
enlightenment,
yeah.
come to physiotherapy.
That will be on level two.
Yeah, yeah. First come and get all right, then get enlightenment. First get
Right.
alignment. Once you get your alignment, then you get enlightenment.
So I think as point of moment, I want to talk about our collaboration.
Yeah,
This I want to take privilege to talk about because this is our first podcast. So I met Sandhya in one of the event, and for many years we are in touch. So we're talking and sharing our ideas, and after enough discussions, we got to know each other better, and that we thought that we have to work on these three areas. Like first is preventive, curative, and rehabilitative, and also the lifestyle. After that, fourth one, fourth dimension. So that's what we are focusing on, and we are also talking about a telephysio, telemedicine, or rehabilitation, and we are coming up with a lot of programs, and also for physiotherapists, also for general public, a lot of services we are going to launch. So stay tuned with us, and I would thank, and she's very energetic lady. I'm so much inspired by after meeting her, and thank you for launching this brand Telephysio, and we are working in collaboration. Our Physiocure clinic is working in collaboration with Telephysio brand uh, for launching a lot of programs in future. for you
Yeah.
guys.
Yeah. Thank you
Yeah.
so
Anything
much
you want to
for
say?
yeah, thank you so much for telling about our collaboration. Even I'm so excited because I know Dr. Amit for past. We met in 2023 at ICPT when I was launching my book today. So like it's been like yeah, at the time we were thinking what to do, but we were in the conversation. At some point, we got to know that this is the right time for us to go forward because the world need us. Because always going all alone, if you want to go fast, it's okay, but we want to go far. So that is where we came up with this collaboration where Telephysio is collaborating with Physiocure and Physiocure is collaborating with. This is a complete extreme south and Telephysio is in Maharashtra. Physiocure is in Maharashtra and Telephysio is in Uti. It's a small station in Tamil Nadu. So I'm also super excited because I know Dr. Amit as a very humble and very amazing person because sometimes you'll feel it like he has a lot of knowledge, but how always how he keep his humility that way. So I'm always inspired with your humility because
Thank
there is
you.
a lot here. There is a lot here. Everyday conversation, I learn something new and something great. And very, very important is like the compassion and the empathy and whatever you're giving towards your patients and the way you take things. That is literally amazing, which I feel very, very important quality being a therapist or being a healer, being in an healthcare profession. So sometimes
Thank you
like
so much for those kind words.
no, sometimes I feel it like being in an healthcare profession, we study a lot, we learn a lot. Sometimes we feel it like we know everything kind of thing. So
Yeah.
sometimes this that will get into our
Yeah,
head
we have
that
to learn from each other. I equally learn from you every day. Whatever you're
yeah,
saying about me, I learn double than what you learn from
yeah.
me.
Yeah, so that
Okay.
is what. So once we come up with the mindset, like open, like we have more to learn. So because every day is a learning, and we are going to be in a space of lifelong learning. So that is where we are going to expand and we are going to evolve. Because being born in this earth is to evolve ourselves and to help others. So I think so. We are met at the right junction, and we are going
Yeah.
towards a right with the right
Uh,
intention. We are looking
yeah.
forward and my mission, as I always said, we both are working, kind of mission is similar. So my mission is to make India to be the physiotherapy capital of the world. So that is my major
Wow.
mission. And yeah, and I know Dr. Ahmed's mission, like
And my
where,
mission to support you.
yeah. No, why we want to make physiotherapy India to be the capital of the world. Okay. The reason is like we know uh, our ancient country, how much it holds and things like
Yeah.
that. So still the spirit is inside us. Like we are more than because it's still in our DNA. And because now everything from the culture have been taken and put it in a westernized package and again coming back to us. I see that a lot.
Yeah.
So when it is packaged, westernized and coming to us, it's creating something greater. Because when we are talking about this Adi Yogi pose, what we saw is have you seen like how the university is in the other country, how it's located? Can you
Yeah.
see?
Yeah.
So the teachers in the year and it'll be looking going up.
Yes.
But the problem is if you're going it in the up, they have to see down, so the automatically the posture comes down where they can't receive a lot of informations what the lectures are saying. And
Hmm.
I was thinking about our Gurukul system where all the students are sitting down and the guru is sitting on the top of the tree, like where a round thing is built around that. And everyone is looking at this to get a better grabbing, where the posture alignment is happening, where to receive the education or the information, what is the right thing to do about. And in our place also, in schools also, we see there is a podium in every classroom where the teacher stands on that and teaches, so that we can see and we can sit right and we can get aligned in terms of the learning and things like that. So I said our systems are built in a way which is going to help us to evolve, be in alignment, to get enlightenment. But sometimes I feel it like we are going towards it, we are trying to adopt the western because they are trying to adopt us because they have understood the science behind our ancient system. But
Yeah.
sometimes I know we are leaving about having a such amazing system and going outside of that. So I want to make this ancient system, which they are repackaging it and giving it to from the western to our side. We will give the original package to all over the world, and I feel it like we deserve to do this. And I strongly believe we deserve to do this. And we want to give this knowledge, to give this power, and to give this wisdom, because we all have a genius inside us. Only thing is we didn't get an opportunity to find our genius inside us. So we want to help the genius enough, the therapists who are coming and learning from us, and the genius in each and every patient of us. So this is the one
Yeah.
thing where we are going to do it together as a team. So we are going to help our world by from India by Indians.
Yeah, yeah.
Yeah. So this is like I never thought like how this happened, but I'm literally thankful God for helping me to find the right partnership, because like
Yes.
we connected more spiritually. I can strongly say that more in terms of education or technical, all those things are different.
So many people must be wondering what we're talking about. Just to understand that the spirituality dimension is one of the dimension of the health, complete
Yes.
health. So when you talk
Yes.
about spirituality, we are also gonna come up with some programs. So we will also incorporate the spiritual concepts and will help our patient to that level. So this we are talking about, right?
Exactly. That's very, very important, because people always confuse with spirituality and religion. So
Yeah,
spirituality is nothing to do with religion. So every religion has the best posture to pray to the
yeah.
God. Yeah.
I
So
think we should uh, give the last message to people if you have.
yeah, no, so that is what, see, your health dimension is not just physical, because people thinks it's only physical. Whatever pain you're going through, that is only thing. And physiotherapists also thinking the same way. We have to help in pain management. We are not an expert in pain management. We are an expert in bringing functional management. So we are very being a functional therapist and functional experts. So that is what we are going to bring. And this function is not only happens physically, it happens mentally, it happens emotionally, and also it
Yeah,
happens spiritually. So all this four dimension is what we are planning to work in terms of training our physiotherapists and also training our patients. So to bring the complete change, and as we said, we will help you in alignment, then later you will get your enlightenment. That's
yeah,
it.
yeah,
Done.
yeah, yeah.
Your last words.
So yeah, whatever your mission, as you said, that I totally agree that we Indians can do best in whatever we are doing. So last word, physiotherapy is about preventive, curative, and rehabilitative, and beyond that also lifestyle management, taking to your best of your health or optimal health.
Yeah.
So we have that potential, and we are coming up with a lot of programs like this, and we want your blessing, Dr. Sandhya and myself. We want your blessing, and that's it.
Mhm. Thank you so much. I literally had an amazing conversation with you, Dr. Amit. Thanks for
Thank
coming.
you,
Like,
thank you,
yeah, thanks for coming, accepting the invitation. Thanks a lot.
thank you, thank you, thank you, thank you,
Yeah.
everyone. Bye.
Bye. Just. Yeah, thank you so much for the audience who are listening to us. Like, we did this podcast to tell you that we are going to come up with amazing for physiotherapists and also for the general public in terms of providing a lot of awareness programs. What is new things are happening? What is the trend is happening? Like, how you can take the right decision, what to do, what not to do, because that is very, very important. But sometimes we know what to do, but sometimes we don't know what not to do. So all these things are going up with as a telephysio show, as a series. So we are going to do a lot of series in the name Telephysio Show. So and we are looking forward to have more audience, and make sure you share it with all other people. And we are super duper excited for our upcoming collaboration. Thank you so much for listening. Harita, you can bring. What happened?